The situation of the last few days show that we must continue to be careful. I know that some of you are anxious to know our action and our measures for certain regions, but we must do things correctly. And before doing that, we must monitor the situation well and rely on evidence. And today, Santé Publique recommend that region must remain yellow, but we will not hesitate to upgrade regions to the orange level if necessary. I want to send to the Quebecers a very, very clear message. You still have the power to ensure that your region doesn't turn to orange. This is not the time to take advantage of the weekend to have parties and gathering without respecting the measures. I mentioned on Tuesday that bars, and even if they serve food, can no longer sell alcohol after midnight. And that also includes restaurants and microbreweries. So all establishments that sell alcohol. Thank you, and have a nice and, most importantly, safe weekend. Merci beaucoup.
And we're seeing a steady increase in hospitalizations and in intensive care unit occupation. Is that troubling at all? Is it worrying to see that slight rise?
It's normal that if there is more cases, that more people are hospitalized. From what I know, it's still people who are from the long-term care facilities or elderly persons. I think it's normal, but the rate is still low, actually, comparing what we had before.
Can I add something? It's too high. We should not see additional hospitalization because of, I think this is our job, is to make sure it doesn't go up.
The reason why you made a press conference today is to encourage Quebecers to respect the rules so yellow regions can go back to green, and the ones that are close to the orange color, they should get a warning. Why don't you reduce the number of people in private gatherings then, if you don't want to go to orange, because it's a very complicated process if you want to come back. So first of all, why don't you reduce the number of people in private gatherings, or why don't you raise the fines? The Ontario government is has just tabled a bill to raise the fines from $10,000 and they can reach $100,000.
I tell you, we are in discussion on those things. I think you'll have some elements from Mrs. Guilbeault tomorrow. That's the reason she's making a press conference. And I think in parallel, we'll follow very closely the numbers, because I think it's a balance of doing the right thing. I think we've been increasing the measure. I don't like closing alcohols at 12. We don't like doing putting people with masks in the RPA. We don't like those things, but we need to do them. If we need to have those additional measures that you're referring to, additional increase, how we, I don't want to scoop what Geneviève will be telling you tomorrow, but I think you'll see some all those decisions that are justified by the group or the region being in the yellow zone, and you'll see that tomorrow.
How much of an impact do you think, from a public health standpoint, would having police breaking up parties at home make on transmission? What would the impact be if police were given that power?
The impact will be if it makes people do less kinds of those things. It's clear that if it's a risky situation or behavior, by having, I would say, police doing this kind of thing would be helping probably the case of lowering the numbers. That's as we do that with any contravention for high speed. When you see the police, you go down. So it's so that's the issue. But at the same time, there is, I would say, analysis to be done by the Vice Prime Minister, Madame Guilbeault, around the capacity how to do it. There is laws. You cannot get into a house without any mandate and things like that because of respecting privacy. But I think that's part of all the things that are thinking actually. That's good questions. You have good questions, and that questions that we have too. And we are now looking at it. And you know, the thing is, what is the right timing to do it? If we go too fast, people can react in a bad way. If we are too slow, that's too late. So that's exactly what we are evaluating. But you have good questions that I can tell you are discussed by everybody here.